What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. Today's video we're covering how much time is actually spent radiating or giving radiation to patients as an X-ray tech. So to give you context, I am a night shift X-ray tech. Been doing it for 4 years, work a lot of overtime and day shift by choice. So I would say for the common folks who do not know, depending on if you're doing fluoroscopy or if you're doing surgery or if you're doing ortho, the dose of radiation you'll give to a patient will be minimal. Unless you're doing surgery, those have higher durations. But the actual essence of you shooting an X-ray, it will be literally like a second. Like any chest X-rays, like just a simple chest X-ray, I would say maybe 1 to 2 seconds. It all depends on how big the patient is. If the patient's really big, you'll have to adjust the technique and you'll hear the long beep. So usually you'll hear one beep that is getting ready, and then the second beep will be beep. And that means the duration of the second beep is how long the patient actually is getting exposed with radiation. A lot of the times it'll be pretty short, like 1 second, like I said. Other times, if you're shooting someone really big and you hear that second beep and it's a beep, like a good 5 seconds, 10 seconds if it's a really huge patient, but majority of the time it's pretty short of the actual radiation of the patient. It's pretty small, I would say. Now, if you're doing something like fluoroscopy, where you're actually on the fluoro tower, and usually the RPA is the one kind of controlling. The RPA is the one below the radiologist, is on the fluoro tower. Usually they'll have like a little footstep, like a little pedal. Well, they press it and radiation is actively, like as the picture shows up, which majority of the time it will be like moving, like if they're doing a small bowel or if they're like swallowing contrast, and you'll see like actively seeing the real-time radiation, like the real-time picture in motion of them swallowing stuff actively as they're pressing. Radiation is being emitted, which once again you can't feel it, can't nothing, you can just see it. Then there's longer dose of radiation. Same thing if like you're working with the C-arm, which is C-arm is like in surgery, it's like two giant, like almost like a headphones, you could say. One is like the actual like receiving the X-ray, the other one's actual like the cathode and the anode. Those, I would say, it can vary because sometimes maybe they need a scout and you just click the button and boom, like not even a second, a millisecond of just a picture. Other time, if they're actively working on maybe putting hardware to stuff, the radiation dose will maybe longer. It could be, I've seen someone have to actively press it from like 30 seconds up to a minute at most. Majority of the times, depending on where you work, there's like a set dose limit of amount of radiation. Usually your machine will have it, or you as a technologist has to be aware that there's a set amount before you're like, you have to let the surgeon know, like, hey, there's a lot of radiation.